Welcome to our webcast. We're at max capacity again tonight. Thank you all for joining us. My name is Brandy Meeks. I'm the Vice President of Operations with And Then There Were None. Over the next hour, we'll be discussing some of the health and safety concerns for women who visit abortion clinics and their licensing issues as well. What I especially want you to keep in mind is that we'll be hearing from two former workers who worked in two different clinics with health code issues, but this is not an anomaly. When you hear about inspection reports for clinics around the country, remember that there are workers just like these brave women who have very real stories to share as well, just like our founder and our leader, Abby Johnson. In fact, at And Then There Were None, we've helped over 500 workers leave the abortion industry, and they all have stories similar to what you're going to hear tonight. So don't allow people to tell you that this is just one person's word against the abortion giants. It's really important for us to know. There are over 500 plus other people who've also witnessed some of the things that we're about to discuss. So this is the plan for tonight. We're going to do introductions first, and then we'll start answering some of your questions. Please remember that we can't possibly get to them all. We'll try, but if you have a lot coming at us, it might be kind of difficult to do. And I'm going to do my best to make sure that we stay on time and wrap up in the next hour. And this is going to be hard, though, because we have a lot of stuff to talk about. This is also being recorded, so we'll be sharing that link later. So that way, if you hear something or see something that you want somebody else to know about, you can share this video with them in the next few days. All right? So let's get started. Like I said, we're going to start with introductions. Noemi, would you mind sharing a little about yourself, where you worked at, and what opened your eyes to leave?
Sure. Hi, everyone. My name is Naomi Padilla, and I live in Tampa, Florida. I've been a nurse and LPN for over 20 years, the last 10 here in Florida, and for 4 out of those 10 years, I worked at a clinic called Tampa Women's Health Center. It's an abortion center, and I started as the surgical nurse, and 2 of those years I was upgraded, or I was the interim director, the interim executive director when the executive director was hurt. So for 2 of those years, I ran the clinic quite successfully, unfortunately, but I was in charge of hiring, firing, procedures, everything. And they were hard. They were really gruesome years, and it really opened up my eyes. When I started working there, it was under, I really thought I was helping women. I went in there because I was going to do the best thing that I can do, be the best nurse that I can be for women, give back to my community. And it was the complete opposite. The complete opposite. I started to really have my eyes opened. Like I said, halfway through, I met a woman. She came in for a sonogram. It was a very wanted pregnancy, and she just could not get an OBGYN appointment soon enough. So I sonogrammed her because we turned no one away. And the thought process was, if we can get them in for the sonogram and they've paid for it, if something happens, they're going to come back because they're already invested in this clinic and in this facility. So I went ahead and did the sonogram, and she was very grateful. She hugged me. Never had I been hugged after a sonogram. She was just so happy, and that was new for me. And she came back a couple weeks later and said, can we just check and make sure? She was on the older side. Can we just make sure that the baby is okay? And we never even used the term baby. We never called, the fetus a baby. And I said, okay, we can check on the baby. And she came back 2 weeks later, and she came back quite a few more times. So progressively, I was watching the baby grow, and I bonded with her family, her husband, her mother-in-law. She even went as far as to say, I want you to come to the baby shower. And so I felt this was like, wow, it was a good feeling. Especially where I worked, we didn't do that kind of stuff anymore. I hadn't held a baby since I started working there. So I get a phone call. Here we are, fast forward a couple of weeks. I get a phone call from a hospital saying they had a woman who needed to come in. She had a fetal anomaly, and she needed a procedure. Very routine for us. So I started to take report. In the middle of that, I get another phone call. I put that one on hold, and it's the same woman. She's in tears, and she's telling me, I'm at the hospital, and they're telling me I have to go see you. I'll be there in a couple of hours. I have to have a procedure. I won't make it. The baby won't make it. So she's in tears. She comes over, and my gut instinct was saying, postpone this. We need to get medical records. But that wasn't the policy. It was get them in and get them out. We needed to seal that procedure. We needed to get the payment and just hurry up and terminate as fast as possible. It was a 3-day procedure because she was pretty far along at this time, and she kept coming back every day. She did this procedure without any sedation, and I held her hand through the entire thing. 5 days later, I get the medical report, and there was no anomaly whatsoever. The procedure did not have to get done. So that just broke my heart. It tore me apart, and that was when I started to tell myself I could not do this anymore.
Well,
It took me some time afterwards, I'm sorry, but that
Yeah.
was my breaking point.
Thank you for sharing that. I'm sure that's still hard to be able to talk through. All
Yes,
right.
ma'am.
Jane, would you please introduce yourself? Tell us a little bit about yourself, where you worked, and what was your breaking point?
My name is Jane Mitchell-Warwick. I am a registered nurse and have been for a little over 30 years. I was a hospital nurse, and I too, like Naomi, wanted to make a difference and thought that, especially for women, and thought that Planned Parenthood would be a spot that I could help and help women. So I started to work at Planned Parenthood. I only worked at Planned Parenthood for 23 days. It really was a nightmare, and it was 23 days of honestly many lacking. It was unsafe. It's an unsafe place. I worked at Delaware, Planned Parenthood of Delaware, at both sites in Wilmington, Delaware, and also in Dover, Delaware, and both places were the same. It was a nightmare. There were no protocols. There were no guidelines. So you really were pretty much left out there. It was unbelievable. Coming from a hospital and going here was, honestly, it was totally different. There were no rules. They just do their own thing. So that is why I went there, and I left because it was dangerous for women. It's actually dangerous, and the women were not being cared for. It was a meat market, and it absolutely was. They were brought in, and there was no HIPAA rules, where you're supposed to have privacy. That wasn't happening. Women would be lined up next to each other after their abortions in the same room, and some would know each other. Some would be like, "Ugh, that's my neighbor," and it's like, "Ugh, well, we don't have any privacy thing here. There's no curtains even between the patients." It was horrible. It was absolutely horrible. The doctor was always in a rush. He was there. He flew in to the airport. The Planned Parenthood people, upper echelon, would rush to get him from the airport and drive him, kind of like, he was chauffeured over, and he came in and he wanted the patients to go. He wanted them on the tables, and he was trying to get them as fast as he could and get through them. So I saw a lot of things that were unsafe, unsanitary, absolutely unsterile. Everything that you hear is the truth about Planned Parenthood. So yes, so that was why I left, because it was absolutely unsafe and dangerous and all those things.
Sure. And that all makes sense. It's all stuff we've heard before, but it's different whenever we see it with our own eyes, right?
Right.
Okay. Well, Pam, would you mind sharing a little bit about your own story and your role within the Renan?
Sure. My name's Pamela Whitehead. I'm actually a certified medical laboratory technologist by trade. I worked in the medical field for 20 years. I started out in the Army, working at Martin Army Community Hospital. Was also a contractor for the Air Force after I left the Army. So I'm very familiar with the inspection process, and we're inspected every 2 years. So I know all about it. And in 2012, I actually stepped into pro-life ministry, started off as a sidewalk advocate. I met Abby Johnson while lobbying for HB2 at the Capitol. I have my own abortion story. So a lot of what is on Check My Clinic and the reasons why we do it are, it's personal to me, but in a sense that I don't want other women to have to go through what I went through. I had an abortion in 2001 in Tuscaloosa, Alabama, at West Alabama Reproductive Services, and the physician, Dr. Thomas Payne, actually perforated my uterus, and there were a lot of events leading up to that moment that were flags for me that I should have known, and probably left the clinic, but at the time I didn't. I felt like this was the only choice that I had no other option. When the injury happened, I didn't really realize what had happened until I got to recovery. Once I was in recovery, I noticed the other women were very relaxed, kind of sedate, you know, and the medication they'd given me hadn't really kicked in. It took them a long time. It took them 4 times to get an IV started, which was a flag I should have known. And then by the time they got it started, the medication didn't really work. And so once, you know, the procedure itself didn't take very long. And they put me into recovery. Medication's still not working, and I was feeling this pain, and everyone else was kind of relaxed. And I'd already had 2 children. You know, this pain was odd. It wasn't normal. I got up to go to the restroom. When I stood up, I hemorrhaged. It felt like something popped on the inside of me, and blood just poured out of me. Kind of like the scene in Unplanned. I mean, honestly, when I saw the movie, and I had an overwhelming flood of emotions that came back to me. You know, 15, 17 years past this procedure, and it all just kind of hit me again. Long story short, they took me back into the room and tried to stop the bleeding, and they couldn't. So they had to call an ambulance, and the ambulance came. Before the ambulance came, they put me on a gurney in the hallway, in a back hallway with no light on, by myself. And I just stayed there. And throughout this whole time, there were 5 or 7 women who left the facility, and they never once went out and told my support person what had happened to me. So my support person was still waiting for me in the lobby, and saw 5 or 7 women come out who had gone in after me, and was very concerned. And it wasn't until the ambulance actually reached the facility and was ready to take me out that they told him what had happened. So, you know, we hear stories all the time, or, you know, we hear people say, well, those things don't happen. That's very rare. It's uncommon. You know, abortion is a safe procedure. It wasn't a safe procedure for me. You know, and people say abortion doesn't hurt women, and well, abortion hurt me. And just as our workers have a story, Abby has a story, I have a story, there are many other women across this country who have a story. And many of us share our stories and our experiences because we want to give hope to other women that you don't have to go through what we went through. And part of the reason we created this site, Check My Clinic, it's checkmyclinic.org. It is a comprehensive database of inspection reports for abortion facilities from around the country. We've made Freedom of Information Act requests to all 50 states, and we have a database of clinics. So we made those requests for every single clinic that's in our database. And the responses that we got and the reports with deficiencies, we've uploaded onto this site. We've summarized those reports so that it's easy to read for the layperson, someone who may not have any medical knowledge. But we've also uploaded the actual PDF report so that you can see it for yourself and not just take our word for it. And so that's why Check My Clinic exists. And that's my story. I've been working for Abby since 2016. I started out as a prayer team coordinator, a client manager, event coordinator, and now it's kind of become projects manager. So that's kind of an all-around title. So thank you.
Yeah, thank you for sharing. And Pam didn't mention she's like the most fabulous teammate ever as well. So super thankful to have her on our team, and very thankful for her management of the Check My Clinic site. It's really opened up a lot of people's eyes to some of the stuff that's going on behind closed doors. And so that actually brings us to our first question. Jane, can you please share for us what's the most disturbing issue you've seen regarding how what you saw in the clinic impacted the future health of patients, specifically if they wanted to have another pregnancy in the future? Do you have anything you can share about that?
Yeah, Yes, I do. There were many things that I could tell you how horrible it was. So it's hard to pick just one. Um, Blood on the top of tabletops with doctors rushing patients back and having patients that were, rushed out, that there was no time to clean those beds in between, and the next patient then on that bloody spot from the prior patient. That could be something that could affect people's future. That's for sure.
Yeah.
The instruments being not sterile is another huge thing. We would have so many patients. We didn't have enough instruments, so that was another huge thing that could affect people's future. I mean, there's loads of things. One that was one of my most disturbing was Rhogam, and this is a medicine that we give to patients that have different blood types, a negative blood type. So just to kind of make it kind of sound simple, it's just if you're O negative, if you're negative of any type, negative, you have to have this shot. And this shot's very important because if you don't have this shot, that prior babies, in your future, you may try to get pregnant, not be able to because you didn't have this shot, and that you were, a negative blood type. And at Planned Parenthood, patients, because of the high volume and the high speed, patients were not, you only have, 45 minutes to see a patient, and that's when they come in. As soon as they come off the table, it's one blood pressure. You only take 3 blood pressures, and they're out the door. Even if they're groggy, doesn't matter, because they have to keep moving. So if you have, you're in charge and you have your 10 patients, there's no way that there's ways that things are going to get missed. And in this case, many cases, many times, these patients were leaving and not being given that shot, the Rhogam. So
Wow.
yes, and that's really scary because in the future, you have women. I am actually a nurse. I actually am a fertility care nurse practitioner now. I see many patients, many that come in that are having some infertility issues, and in the back of my mind, I always think, was she at Planned Parenthood that didn't get that shot, and this is why she's continuing to abort, so spontaneously abort. So yeah, there's things like that are absolutely horrible. And at the time, I had gone, and remember, I wasn't there long, so I was pretty quick on that. So as soon as I saw those couple of women going out without that shot, I was like, well, we need to call them. They need to come back. They have to have that shot. And it was like, well, we can't, because everything's kind of kept on the down low, so to speak. And so you can't just call them back. You can't call a secret code because we can't call them. Because they're, it was a secret kind of thing. So so you don't call them, and these patients go out. So I did go to the director, the medical director at that time, Dr. Carol Myers was her name, and I said, listen, we can't do this. Like, these patients are leaving. They are leaving without that. There's no protocols. There's no rules. Like, you can't see this amount of patients and give them safe care. And I don't care. I mean, as a nurse, you're an advocate, and your job is to take care of your patient. So, and the doctor simply said, well, we need to work on that. That's something, if you want to write a protocol. And I was just like, wait a minute. I didn't say I was going to be the one writing the protocol. You're the doctor. Like, you're the one that really should be doing that. So it was a horrible mess that way. So yeah, patients would go out the door. They would go out groggy. They would go out onto Market Street, and they would be, sedate, and and there they go. Like, we would never, in the hospital, we would never allow a patient to go out the door like that. Are you kidding?
That's so disturbing. That's so disturbing that would happen. No, Emmy, did you see the same thing where patients were leaving that were not ambulatory, that shouldn't be out of your sight, out of your care?
Absolutely, absolutely. There wasn't any quality care that was given to any of the patients. It wasn't individualized. It was an assembly line. It was get them in and get them out. Jane, you had 45 minutes. That was a very graceful period. We had less than that. The faster we got them in, the faster we got them out. If they were throwing up, you know what? You can throw up in the parking lot, but we need that chair for somebody else. If they were so sedated that they couldn't walk on their own, because they're these teeny tiny little petite women, and we're giving them a standard dose of sedation. The syringes, they're all pre-filled. It's not customized for every patient based on their height, weight, history, like any other facility or provider would do. No, it was one pre-dose syringe. We prepped the syringes for the entire week. We had to be ready to get everybody in and out. So we didn't.
They were prepped for the entire week, even though no matter what the patient,
matter what,
their weight, who they were, nothing.
We would prep them. We would have staff prep them. Not to mention there was staff that wasn't qualified to prep these medicines, these medications. They weren't licensed nurses. Some of them weren't even licensed at all. They were just trained. They were licensed under the name of the facility, and they would prep these syringes, put them in a little basket. We would keep them in the back, and we would just grab them as needed. And they were in Ziploc bags labeled what they were, which was a big issue in itself, because quality, quantity, and you're putting something in the wrong bag by mistake because you have to hurry up and get that next patient in. Now you could have given somebody the same dose twice.
Unreal.
So, and it was just get them. Honestly, one of the morbid jokes that we used to joke that we'd say, the director and the owner would say frequently, we need to put in a drive-through window on the side so that we can get these done faster than McDonald's.
Goodness. Jane, did you, like what Noemi was just sharing about with other people taking on roles that they weren't qualified to do, did you see the same thing? Oh, you're on mute still. It happens.
There we go. Yes, absolutely. Yes, I witnessed that often. There were people that were in positions that they had really, like I said, there were not many qualified people. I thought that phlebotomy, the phlebotomists were trained phlebotomists, but they weren't. They're just Planned Parenthood trained, which means they just train them how Planned Parenthood just guesses and just says, go ahead, you can stick that needle in that person. And I actually had an incident, even when I was talking about the Rhogam, which is a perfect example. I had a patient that was negative, and she had came in, and she was, again, zip, 3 blood pressures, you're out the door. And she said to me, I said, okay, well, you're good. This is your medicine, blah, blah, blah. You're out the door. And she's like, well, when I had my son, they said that I'm supposed to always get a shot. And I was like, immediately, I'm like, oh my gosh. I look back to make sure that, of course, because you're rushing, like, am I making a mistake? I went back and flipped it, and I'm like, no, you know what? Hold on, though. Hold on a second. And so, because if you're saying that you were at the hospital and they said that you had a blood type and you needed a shot, you're going to need a shot here. So let me just get them to redo your blood work. So then you're not even getting blood work that's reliable, because the staff doesn't know how to do that. Even being called into the abortion suite, they call that, to go in and start IVs for other nurses, because the nurses are incompetent. A lot of times they're just incompetent. Where I also had nurses that were trying to climb the ladder to be nurse practitioners, family nurse practitioners, and they really didn't care, because they were there just to get done school. And it was really disturbing. So yeah, no, and again, it's they're licensed, they don't care. All they know is they had a student who was going to do an intern, and she had an RN behind her name. Yes, come on in. So, and again, they were there for not the right reasons, not to take care of women,
That's disturbing in itself. But again, these are 2 clinics. We have 2 people speaking. It would be really great to know, Pam, how does what you're hearing match up with what you see with the inspection reports on the Check My Clinic website?
Everything they're saying, they're not isolated incidents. These are systemic issues that we see in these facilities, especially in Planned Parenthood facilities, because historically Planned Parenthoods are basically run the same way. But private clinics, like where Noemi worked, are not necessarily. But for the most part, Planned Parenthood is a brand, and so they basically run the same way. And so it's easier to gauge where there's a systemic issue when you're looking at Planned Parenthood. Not that we necessarily want to pick on that facility by itself, but because they are consistently the same across the board, it's much easier to look and see that most of these facilities, what we see on their inspection reports are they have unqualified, uncertified, and untrained personnel. Exactly what Jane and Noemi both were talking about. We see narcotics issues where the narcotics count is not accurate. And often that's because they have someone doing the count who shouldn't be. They're not in any way, shape, or form qualified to be handling narcotics. You have to have a specialty on your license to be able to handle those narcotics, and they're not able to do that. We see people pushing IV medications who are not certified, not trained, not qualified to be doing that. There was one facility, the nurse, she said she was a nurse, which she wasn't. She had been working for that doctor for 20 years, and she'd been pushing IV meds. She was not a nurse anesthetist. She had no qualifications to be doing that. But it was her argument that she had been doing that for 20 years. No matter how long you've been doing something, if you're not licensed to do it, you can be driving for 20 years. When the police pull you over and you don't have a license, you're getting a ticket, right? Mm-hmm. Unfortunately, with these abortion facilities, there is no enforcement. And that's what we're seeing.
What is happening with that, though? Like, isn't there some kind of regulation or credentialing of abortion clinics? Jane, can you speak to that at all? What was going on in your clinic as far as who was credentialing you?
Planned Parenthood, actually, this was amazing to me. Like I told you, there were no guidelines, no procedures, no protocols, no books. You have to have these things. In the hospital, you have to have these, even to start an IV. There's certain techniques and things that you have to be able to do. And you have to do it following a guideline. The medicines in the syringes, that's a big no. But you're right. People would go ahead and make them and pull them, and another nurse would give another. You're not allowed to do that. That's nursing 101. You draw the medicine and you give that medicine. Nobody else gives that medicine. Like I said, that was not a big thing. They didn't abide by that. They drew them all up just like Naomi was saying, and that's true. One of the other things that she was saying that besides the narcotics, the count, that's true too. And you would be by yourself counting them. And these are like big time, a lot of narcotics. And you would have them to yourself, or somebody else would be counting them. And it could be anything. People, can steal those drugs. They can suck out the drug and put water and saline in them. I mean, there's all kinds of things, which let me also to mention that the supplies that when they would go ahead to sedate patients, like I told you, there were no manuals, no procedures. Guess what? They had no idea how fast to push medicines. And one of the medicines that we would push was called Versed. And with that medicine, we're supposed to give that over a certain time. And I asked where the guidelines was, where the guideline was for that. Where was the procedure for how long to push that medicine? And they said, we don't have that. I said, you have to. They said, I said, you don't have it? I can't push it. See, so I wouldn't push it. So I'm like, I'm not pushing that. They said, Jane, just slow. But slow doesn't cut it. And a lot of times medicines have to be diluted with with saline, so you don't burn the person's vein out. They don't care. So now I kind of forget where I was going with all that, because you know why? There's just so much to tell you in such little time, and you don't get that opportunity to be able to say, everybody, this is true. This is honest to God true. There's no benefit for me to come and say these things about something. I wanted to protect women. I still protect women and still care about women. So, women going out the door, not getting the right things, that happens. Doctors bringing patients back on bloody tables, instruments that are not sterile. The packaging is wet. They open them up. There's a special tape that has to turn color. That's not even turning the color because they pulled them out, the instruments out before they could even, be sterilized.
Right.
It was, right. I mean, yeah. What was the question now?
Well, no, this is all great information, but what I was asking is, are there any, especially in the state of Delaware, were there any regular inspections or licensing of abortion facilities in your state, and specifically who was doing the credentialing? Like who was
Yes.
saying that you guys were okay? Right?
Yeah, Dr. Carol Myers was our director at the time. Dr. Timothy Liveright was that doctor that was so fast at abortions. He was pretty much the king. But he, but the as far as to regulate and to watch over them, to make sure you're right, because at the hospital you have a team that comes in. It's an independent agency, a whole thing that has nothing to do with that organization. They come in, you get your best nurses on so that you're ready to ask questions and answer those questions from these people that come in and you know, to do this inspection. At Planned Parenthood, there is no inspections because Planned Parenthood inspects themselves, which was another thing that I found out about. And that came from when I went to go report them and say, hey, listen, you know, when I was within that organization before I went to the state to report, that was my finding was that there is nobody, there's no overseer that makes sure that these things are being done right. So with that, I did go and I ended up blowing the whistle on Delaware's Planned Parenthood because of the it was unsafe for women, and it needed to you know, be corrected.
Yeah. Pam, do you have anything to add to that as well?
Sure, I do. So part of what we do with Check My Clinic also is we make complaints to the appropriate agencies that actually have jurisdiction over some of these violations. So when we call it DSHS, the Department of State Health Services, comes in to inspect facilities in states where they actually do inspect, and what we found when we've made our requests is there are 21 states that don't license or inspect abortion facilities. If they fall under an ambulatory surgical center, they may receive they will receive an inspection, but if they don't, then they're just under the doctor's license. So what we've done with Check My Clinic, and in the state of Texas, we started in the state of Texas. So I took all of the reports that we have and I looked at the violations, and I would see a narcotics violation and I said, okay, well, that's reportable to the DEA. The Drug Enforcement Agency actually has jurisdiction over this violation, and since the state health department didn't do anything, then I'll report it to the DEA. There was a facility where the employees had no bloodborne pathogen training. So, you know, if they don't have the training, then they don't know proper procedures. They don't know they're supposed to wear gloves. They don't know they're supposed to wash their hands after they take their gloves off, before they, you know, all of that. Anytime they change gloves, they don't know proper needle disposal. They don't know that you can't reuse or recap a needle, just simple things. They don't know how to
they haven't been
specimens.
Right? They haven't been trained.
And so I reported that violation to OSHA, which is the Occupational Safety and Health entity. And when we reported that violation to OSHA, immediately OSHA sent that facility a letter. The facility responded back and said they voluntarily closed. So based on that report, that facility closed. Now, we do credit all of the prayer warriors and everyone who had been in front of that facility, you know, beforehand, knowing that it wasn't just this incident that closed that facility. We believe in the power of prayer and the power of peaceful, prayerful advocacy, but it compounded, you know, and eventually it showed up. We also made a complaint against we made complaints against every facility in Texas, but specifically one here in Houston where the physician, someone besides the doctor, was administering RU-46, which is medication abortion. It is illegal in the state of Texas for anyone besides the doctor to perform an abortion. That's in the law. It's coded in the law. And someone besides him was handing out these pills. And it was on the inspection report. I mean, plain as day, it said that someone besides him was doing it. So I was like, well, I'm going to report this to the medical board. I did. They opened an investigation. It took about 8 months. But as the complainant, they called me in, and I came and testified with the physician in the room, and just testified to everything I knew that was on the report, just the truth and the facts. And then my own eyewitness testimony of patients leaving not ambulatory, just like Jane and Noemi were saying, still sedated, all of those things. And the doctor on the medical board, he is an anesthesiologist. He said to me, we don't even know about these violations.
That's a problem.
Exactly. That's why these clinics are staying open. That's why these facilities are still able to run with no oversight, is because the appropriate agencies are not being made aware of these violations. The agencies that have jurisdiction over these violations, and we intend to change that.
Exactly. And the most disturbing thing is is that, Noemi, you can probably attest to this. Inspectors are coming. What are you going to do? Are you cleaning it up to show your best face? Like, what does that look like?
Absolutely. That is when you get the overtime and you are working for a week straight to get those charts ready. You get the notebooks ready. You start to date everything. You start to hide the syringes that have been pre-filled and put in that little basket. You throw away the Ziploc bags. Suddenly the autoclave is working perfectly. Everything is taped up and sealed, and that tape is changing colors. All of that is done right beforehand.
And
They
it's
know when the inspectors are coming all the time.
right. They know, and yet they're still getting all of these violations on these reports, right? Like, that's the alarming thing, is that these clinics know that someone is coming, and yet here we are still discussing all the stuff that's happening,
Well,
right?
because they're not practicing the great practices that all hospitals use throughout the year. They're doing it right beforehand so that they can look good during these inspections. And you can't fix a year's worth of issues in 1 week.
Sure.
So they're rushing to get it fixed.
So, Noemi, while we're talking with you, what's the worst case that you remember? A patient that you worked with, anything that really sticks out to you besides what was, your breaking point as well? Are there any other things that really like were alarming to you and just really like something you just can't let go?
So our clinic, it was we specialize in second trimester abortions. In the state of Florida, you can go up to 23 weeks with 6 days legally. And that is it's a very questionable number because it all depends on how you sonogram. You can easily, move that sonogram probe and it'll just now be 23 weeks with 6 days, a couple more centimeters or millimeters to the right, and now you have a 24, 25 weeker. So we had this one young lady, she was there with her mom from out of state. She had traveled because we specialize in second trimester procedures. And she was dated at 23 weeks with 6 days, exactly the cutoff. But since she had traveled, we took her on as a patient. And I kept telling the staff, I kept telling the surgeon, I said, you know what, her belly looks, I mean, I don't need a sonogram. Look at her belly. And they said, you're just so controversial. Let's just go ahead and start this. It was a 5-day procedure.
Wow.
It took us 5 days to labor this young lady out. She was young. She still had her whole life ahead of her. We had such difficulties. We could not get we could not get the baby to pass. We had to call even Boulder, Colorado for advice. Like, we were panicked. I was in the clinic 24 hours a day administering IV fluids, just waiting for the medication to take effect. I mean, it was the worst case scenario. I panicked for this lady's life. I was responsible for her, and I had to give report to her mom, who was in a hotel waiting for her. And I kept this woman 24 hours a day at the clinic. I wasn't allowed to call 911. I wasn't allowed to transfer her to a hospital. It was horrendous.
Thank you for sharing. Again, just that length of time is so alarming. And I know that you were fighting hard to be able to take care of her. And part of that, we had discussed before, is you get into this because you want to be able to help women, and you figure, if I'm not there, who will be there, right? Who will be there taking care of them? And so I was going to leave this for the end, but I feel really compelled just to say it right now. If you're out there and you're on this call, just know that if you are currently working in an abortion facility, that we love you, and we can help you too. And if you entered into this for the same reason that these ladies did, because they wanted to help women, and you can leave for the same reason these ladies did. They wanted to help women. They saw that they were being harmed in these facilities, and just know that there is no judgment here, only love and compassion. This is why we do what we do. This is why we love our jobs. And so we're here for you. So please just know you have a safe place to reach out to, and we can help you. Yes, Noemi?
Regarding that, I just want, if just to reiterate on that, if there's anybody who's even contemplating quitting, I know it's the scariest thing. I contemplated for 2 years and I was petrified. And the people on the inside are going to fill your head with crazy ideas, and nobody's there to help you, and nobody's going to care for you, and nobody will be there like we're there. And that is not true. That is not true. Take the jump, take the leap, cross the line, cross the fence, and there are people all over the place that are going to help you. You will not be alone.
Thank you for sharing that. I love that. Take the leap, jump the fence. We're here. Okay. All right. Pam, would you be able to screen share with us and show us some, just a little bit more of the inner workings of Check My Clinic? Because I'm sure a lot of people are out here wondering now, like, okay, we've heard all of this. Now, how can we find out what's going on in our local states and our local clinics, so that they can just be more aware and informed? Because that's what this is for, right? This is an education piece so that we can help people just be able to make informed decisions, just so the information is all right there in front of them, right? We want to make it easy for them. So can you show us that?
Yes, sure. So I'm going to share my screen. So if you are watching on video, you'll be able to see. If not, then you can watch the recording. So can everyone see?
I can see.
All right, awesome. So this is Check My Clinic. The website is checkmyclinic.org. So when you open it up, you'll see this map. This is an interactive map. As you see, you roll over it and the name of each state comes up. All right. It says here, how does your local clinic measure up? Click on your state to find out. So let's go to Noemi's state of Florida. Yeah, so we click on Florida. The first thing that happens is a light box pops up. This light box tells us the state abortion regulations for the state of Florida. We do our best to keep up with the regulations. As you know, the climate of our country is, everything's changing right now. And legislation is one thing that is constantly changing. So if you know of something or you see something on our site that is not accurate and you have links and proof of a change or a link to a new rule, please send it to us. You can contact us through the site under the tab that says Contact Us. So in the state of Florida, they are required to have state-directed counseling, which is in the informed consent booklet. There's a waiting period. No, there is no waiting period. Is there a sonogram required? Yes. So a woman is required to have a sonogram, but she doesn't have to wait. So the sonogram can be done the same day she has a procedure. Parental consent for minors, yes. The limits are 24 weeks currently, but there is a life and health of the mother exception. So that, affords a woman an opportunity to have an abortion past 24 weeks. Do abortion clinics have to meet ambulatory surgical requirements? Yes. Telemedicine is permitted, so that's what we call webcam abortion. And we'll talk about that on a different call. Public funding, no. So in the state of Florida, Medicaid doesn't pay for abortions unless probably it's rape or incest. Usually those riders are on public funding, and abortions have to be performed by doctors only. So when you look at this state, and we're working to change this, we're making some aesthetic changes to the site so that it's a little more user-friendly. This state has a lot of abortion facilities, so we're just going to click on one. So this is Planned Parenthood in Naples, Florida. I'm going to go back to the state, so I can click on Florida, and it takes me back. And now I see a list. You see that list? So that's a list of the facilities that we have on our site. Tampa Women's Health. That's Noemi's facility. Let's look at what we got here. So we have a report from 2018, and we've summarized it here. No documents in any of the direct patient care employee files, so they didn't have job descriptions, performance expectations, no licensure requirement, which is everything Noemi was talking about. No performance reviews or competency. Again, that's everything. And Noemi's been out of this facility for 3 years, and this was the most recent inspection in 2018, so nothing has changed since she left. None of the direct patient care personnel were certified in CPR. An employee had the job title of registered nurse, but there was no indication that the employee was a licensed registered nurse. The staff didn't report a serious complication or injury of a patient to the appropriate agency. We've also added, these are Google reviews from patients from this facility, so you can click on those and read them. When you click on this here, this is the actual PDF report from the State Department of Health. So When you scroll down, you'll read here, based on record review, it just tells you all of the violations. They performed procedures that were outside of, they experienced complications and they didn't report the complication. They didn't report the serious injury to the agency. So, and this is for every, let's go back, for every facility that we have. Let's go to Texas, for instance. I'll do one more and then we'll move on. Okay, Brandy?
Sounds good.
So this is the largest abortion facility in the country, Planned Parenthood Center for Choice in Houston, Texas. We have reports, so this is an ambulatory surgical center in Texas, and they get inspected usually every 3 years. We do have reports for 2 years because one of these was a complaint. So when a complaint is made to the Department of State Health Services, the department goes in and inspects the facility simply based on that complaint. So they won't go in and do a full inspection, but they will inspect the complaint.
And Pam, I'm going to pause you for just a second because that goes along with a question that has been posed.
Yeah.
How do these clinics stay in operation, ? But then more importantly, do the health departments completely turn a blind eye? So if you can just interject the answer to that question based upon what you're explaining right here, I think now would be a good time.
Well, here's the thing, the health department can only enforce what's on the books. So when they go into a Planned Parenthood facility, what they're actually looking at is Planned Parenthood's own policies. So often what you see are violations of Planned Parenthood's policies, whatever they have written on their books. So they're required to have a quality control, policy, an infection control policy. They're required to keep employee files. They're required to have a quality assurance committee. They're required to have an infection control committee. All these things, these are their own policies. So the violations that are often being cited most of the time are violations of their own policies. So what happens when they violate their own policy, the state gives them the opportunity to make a POC, that's a plan of correction. So basically Planned Parenthood writes back and says, okay, we're gonna fix this. We're gonna have a training, and the state stamps it and says approved. That is the level of enforcement that we have right now.
That's it.
Yes. Now, if we look at like what Dr. Rosenfeld did in Houston, that is a violation of the law. And those violations like that need to be reported to the proper agency, like the medical board. I am going to stop sharing this screen now since we've kind of gone through it. So that actual violation needed to be reported to the medical board because he violated the law, which goes against his license. And, we went through that process. We took it all the way to the medical board. Now, naturally, he had already made a plan of correction and said that he was not going to do that again. Bad doctor, I'm not going to do that again. But no one really knows.
Right. Well, and that's why I was going to ask Jane, what did you experience when you tried to bring this to their attention? Like, I've heard your story before, but I don't know that everyone has. So I think it'd be important for you to be able to share that. Okay, you're on mute. See if you can get it off. Is it not working? Hang on a minute. I unmuted you, maybe. No, it's
there
not.
we go. There we go. Here I am. Yes. As far as the agency and reporting, like I said, they had no rules. Planned Parenthood of Delaware had nobody overseeing them. So they have just been running rampant for however long they've been here. And so when I did go to report, because the doctor, I tried to work with inside of Planned Parenthood first, but when I found out that that wasn't going to happen, that wasn't going to work, then I went ahead and I reported to the state, which is a friendly little form that anybody can fill out. There's one that's for certain just for medical people. So I reported as a medical person, a medical doctor. I reported Dr. Timothy Liveright. I reported all of them actually, and Planned Parenthood. And they got back to me and said that they were going to take care of everything, and it was all, and I, went through the whole list of, like you had said, like the different violations they had. I just, expired medicines, everything that pretty much we've talked about here. Patients going out without medicines, patients wandering out on the road, out on the, on the street, just all the unsafe things that happen, blood on the tabletops, staff not being trained correctly, just all those kinds of things. I reported everything. I was told that they were going to take care of it. In the meantime, I did, of course, at that point I had left. I could not take it anymore. I was trying to make sure that those things were being followed through, but it was an unhealthy environment at that time for me because they were not very happy with me. And but that didn't matter because it was, what was wrong. What they were doing is wrong. So the truth needed to be known. So I let them know. The state told me that they were going to go in and get that cleaned up and let me, get back to me. And nobody ever got back. So I got them. They said, oh, yes. I called them and said, I just want to make sure that I wrote that, it took a long time to write all that. I want to make sure that these things are I'm not there anymore. And that was what was bothering me because I had quit and I was trying to hang in there to make sure that things were done. I didn't want to leave. I just wanted to make sure that these women, these girls were going to be taken care of. And knowing that the other nurses there were like, Jane, you're just going to get blackballed. It doesn't matter. The state does what they want to do. Even with the consent to the oral abortion medication, there's a certain way we give it, and we're supposed to inform patients, and we don't. We're just told, oh, you just sign this. They don't need to know that. Those kind of things. But there was no nobody regulated it. They did their own thing, and it was apparent that they did their own thing. And when the state said they had gone in fact, they did not go in. And what had happened was it was really, this was definitely God sent. My husband was watching TV and he's like, hey, Jane, this is like 3 weeks later after I'm long out of it, but I had been very busy. I had called OSHA. I had done a lot of crazy things, calls everywhere that I could think. I didn't know Abby Johnson even existed. I really didn't know any of that kind of stuff. Thank God I ended up meeting her and was able to talk to somebody that actually got this. But with that, they did not do it. They said they did. The actual state, the health department of Delaware said, yes, we did that. The regulations, the professional license people, we did it all. We took care of everything. Nothing had changed. And I knew that because my husband was watching TV and he said, Jane, there's that thing on here about Planned Parenthood. And I was like, oh. So I went in to look at it, and it was a patient that was being wheeled out on a stretcher, and they had an oxygen mask. And I remember very clearly the oxygen mask was not pliable. You couldn't use it. It had just been in there just rotting away, dry rot. So you couldn't even put it to form it on her face. And I remember there was a grandmother who was videoing the incident, and which is what really brought my attention to the whole thing. And I saw that they were trying to get this on her mask, and I heard this video that was being done saying that it's not working, like they're having trouble with the oxygen. And I knew that they were having trouble with the oxygen mask. And at that point, I realized they never went in and inspected them because that would have never been there. There would have been not a mask that was not pliable and that kind of thing. So with that, I was furious. I called like the drug DEA and those places, all the places I could possibly think of, OSHA. It was OSHA. I was like, okay, you don't care about the patients? And they're like, no, we just care about the employees. I said, okay, well, then come see the employees. There's plenty to see. So, it took a lot just to get somebody to listen. So the Planned Parenthood ended up, it was, there were a lot of different things, and they didn't have any oversight. So Delaware realized that. And, through this, the second time around, though, this is what's the puzzling part. They didn't do anything the first time. And knowing that they didn't do anything at that point, then they lost all credibility with me. They were just, they were untruthful. They were untruthful. Right. And that, as a nurse, is absolutely horrible because your job is to protect patients. And for me, it was unbelievable. But they did go through, and the next time they went to do another inspection, the real inspection, they never saw the first inspection. There was nothing done. But the second inspection, because I asked I would like to see the information that they gathered, how many syringes, what was what they found, and they had no report to show. So the second time in, they did go in, and then Planned Parenthood closed down for, I don't know exactly how long they closed down for, but they closed down for a while because they were closed down. That Dr. Timothy Liveright was given the opportunity to hand over his license in the state of Delaware, which he did. And And, so no one came after me because people were like, oh, you're blowing the whistle on them, which I really didn't know anything about, but I just could not believe. I was just so alone and thinking, nobody gets this. Like, I'm the only one that sees this. Like, these people and the nurses that are there don't care. Like, they don't,
Right.
they're just there.
I
And
remember
so,
you saying like you were warning them.
oh, I
Like,
did.
you better
I
come on
did.
with me
I
because
did.
something's
I
going to
did.
happen. And they kind of laughed like, no, there's nothing going to happen. And you
They-
thought, okay, fine.
You're going to get
Right. That's
blackballed.
on you then.
Right.
But
Right.
then
And I
nothing,
told them.
but they knew though. They knew that nothing would happen.
Yeah.
And then with Dr. Libright, they even moved him someplace else. They made him surrender his license in Delaware, but then Planned Parenthood put him in moved him out to the West Coast. Correct?
Right. That's correct.
Well,
yes.
and that brings, we have one last question that we can answer. And that was, does it help your organization to be connected to local pro-life state government representatives to help shut clinics down? I'm going to tell you, it can never hurt, right? Can never hurt for us to be connected with people that have some influence. But I will tell you that part of the focus needs to be done on enforcing some of these laws that are already in existence, right? So many times we get so caught up in all these new laws and new things that are rolling out, but hey guys, let's enforce the ones that are on the books now, right? Like if somebody is breaking the law, let's make sure that we have some repercussions from it and it doesn't slip through the cracks. Pam, do you have something you want to add to that?
I do. There's one thing that I want to say. We focus, and I hope that our community can hear me right, but we have put our focus so much on saving the unborn and humanizing the unborn. And if we would look at what the other side, so to speak, is doing, their focus is on women, and it's on women's rights. If we would begin to turn our focus to women and women's rights and their health,
That's right.
we would be winning this fight in the legislature. And I'll tell you why. Because we have proof, you've just heard it on this webinar, that abortion harms women. And the whole guise of abortion in this country is that it's a health option. Health care heals. Medicine is for healing. It is not for killing. And what is happening is we're harming women, and we have proof. So we need to get the proof, and we need to take it to the people who can actually do something about it. And so together, yes, we need to work together. But just like Brandy said, there are enough rules, there are enough regulations, there is enough legislation already on the books to make a difference and to close many of these abortion facilities. A lot of people want to focus on overturning Roe v. Wade, but that honestly is not our focus. Our focus is improving women's health and proving to women that, look, this is not healthcare. This is not helpful, it is harmful. And the moment that we begin to make abortion unthinkable, not just unlawful or illegal, then we're winning. And we can do that by speaking out just like we are, showing women this website. This website is made for you. It's made for women. This website is for any woman who's seeking an abortion, any woman who's seeking health care in a Planned Parenthood facility. This website has resources available to you. Do you know that federally qualified health centers actually outnumber Planned Parenthood 20-1? And they offer comprehensive health care. They even offer health care for your husband, for your kids. They offer dental care. Many of them offer substance abuse counseling, mental health care. I mean, it's a comprehensive health clinic that doesn't offer abortion. So we've got resources available on the site as well for women who are seeking healthcare options.
Excellent. And our time is coming to a close. But again, I just want to thank the ladies that are on this call. Just to stress again, the same thing that led you in is what led you out, wanting to help women. And we are so thankful just for your bravery and your courage and joining us tonight. And not just tonight, like you guys are leading in your communities. You are leading this cause to be able to bring awareness to this issue. So we're really grateful for you. And again, if we have any current workers that are on this call, we just know our heart, right? Like, we are here to help you. We want to help you. We can help you. And you can leave as well. You can find that strength as well. And also, if you're sitting there tonight and you feel compelled that you want to help us rescue more workers from the abortion industry, you can also make a gift to our organization by going to abortionworker.com, clicking on the donate tab. And finally, if you'd like to stay connected with our organization, you can also get text from Abby. So please text NONE, N-O-N-E, to 53445. And again, that's NONE, N-O-N-E, N-O-N-N-E, to 53445, so you can stay up to date on all sorts of projects that we're working on, and then there were none. Thank you for joining us this evening, and we hope to see you again really soon. Thank you. Take care, everyone.